with a total knee replacement. I know last time we talked about maybe some management of the arthritic knee conservatively, but at some point, sometimes those will get to a point where surgery is warranted. And what I found is that a lot of my patients who come in weren't educated well on what to expect either from the surgery or what to expect before or afterwards. And so that's today's kind of video goal, is to discuss what to expect before, during, and then after, and kind of outcomes as far as what to expect. So with a total knee, there's a lot to consider, and it is a life-changing surgery in that hopefully it gives you a lot of your life back in terms of function and ability, but there will be a period of time where maybe you're down and you can't do as much, and that's where physical therapy will come in and kind of help you get stronger and get up to a point where you can do the things you want to do. But before, there's some tips that we have as physical therapists. Do your prehab or your pre-rehab, right? A lot of folks going into knee surgery have had knee pain for a long period of time in ways that it makes it very hard to get over that hump after surgery if those still exist. So what I always tell folks is we need to really work motion. Yes, it's probably going to be sore, but if we have better range of motion and better strength before surgery, the outcomes are going to be a lot better. So if I can get you in maybe even once a week to physical therapy, so where I can work on you, a lot of folks will lose that full extension of their knee because they're fading their knee, maybe they're limping. If we can get that more straight, that just makes it so much easier after surgery. So make sure you do your prehab and then make sure you're strapped to it. Again, it's probably going to be a little bit sore. That's why you're getting surgery, but keep the end in mind is that, again, if you're stronger when you go in, the stronger when you come out, the much faster, much easier recovery is going to be ahead of you. So you're going to go in for surgery, and kind of that day of type deal, you're going to check in and they're going to get all prepped up. And then basically they do glorified carpentry on your leg, and it's amazing what they can do. But so we've got a knee here. This is going to be your inside. This is going to be the outside here. And then we're going to get the kneecap here. So I'm going to take this kneecap off so we can kind of get a better look at the knee. And we're going to pull this down. And what happens is that basically the surfaces here get covered with some sort of metal alloy, a lot of times titanium, and the surfaces down here also get covered. The meniscus go away, as do the ACL. For a full knee replacement, they end up with a kind of more latching mechanism within the hardware itself. For partial knee replacements, and that meaning either one half of the knee or the other half of the knee are replaced, but not everything. Sometimes the ligaments are spared, sometimes they're not. So that kind of depends on the surgery and the surgeon you have. But universally, what tends to happen is that they'll come in and they make an incision here to get to the tissue level, and then they're going to retract that, and then they're going to come in from the inside of the knee and make an incision here, and that's where they're going to be able to get to the joint. And so what they do is they kind of pull all this to the side, they bend the joint, and that opens up that joint for easy access to do whatever they need to do. They'll grind this down and make it smooth, get it all level, and then they've got robotic pieces that they can figure out the exact fit, make it nice and tight, make it perfect, and then they button you back up. A lot of surgeons do different ways to close you back up. Usually there's some internal stitching here. And then afterwards, when they close you up here, there's a lot of different ways to do it. Some will still use staples. Some will use stitches, and some will use what they call Dermabond or glue. A lot of times it's an internal stitch with some maybe glorified basically over the top of it that keeps everything nicely healed. Regardless of what you get, the scar is going to heal just fine. Staples tend to be a little more uncomfortable initially just because you got staples pulling on your skin as you're trying to get it moving early, but I don't feel like there's any residual deficit however you get closed up. The big things you want to watch for there is obviously infection. So a little redness around the incision site is totally normal. If that redness is really spreading around or looking streaky away from everything else, or if you start to see things that are leaking other than like a clear discharge, if it's colored, if it doesn't smell good, those sorts of things, we might have an infection. You want to make sure you talk to your doctor about that. Afterwards, you're going to want to manage swelling. That's the big thing, is that the swelling gets out of control and can become painful, and gravity pulls swelling down. And so even though you've had a knee surgery, you're going to see your ankle and calf get really, really big. The way we manage swelling is through elevation. Early on, maybe a little bit of ice. That's kind of contested as far as how well that manages swelling, but it does help with pain. So I wouldn't discourage you from using it as long as you don't get yourself frostbite. And then we want to manage the swelling with elevation, and pumping. Movement helps with swelling as well. So any sort of light movement we can do, the more you walk, the more motion you're going to get, the better you're probably going to feel. So after a total knee, they get everything in, they cement basically all the pieces in, and really there are no in terms of weight bearing or activity as long as you're monitoring your pain. I mean, obviously I don't want you to go run a marathon the day afterwards, but there's nothing to say you can't put your full weight on it. It's completely safe. It just might be a little bit sore. And the more people can kind of get over the hump of like, okay, I can use this, the better you're going to do long-term. The more willing you are to use it and kind of go through that little discomfort of getting it moving, the stronger you are, the faster you're going to recover, and the more you're going to get back to those activities. After surgery, usually anywhere from like a couple of days to about a week afterwards, we're going to see in physical therapy. And that's where we're going to really start. We're going to work on swelling again initially. And we do that with cupping, which we've talked about in previous videos, as well as kind of that light Graston tool work to promote circulation, to promote that lymph flow, to get everything moving back towards the heart so that the body can get that out of the system. And then we might also use some of that kinesiotaping to kind of reduce some of the swelling down there and encourage you to move it. And that's those first couple of weeks is just getting you used to moving it. We're going to give you a lot of range of motion exercises, some light strengthening exercises just to get things back in order. Once you kind of get past that healing point, usually anywhere from 10 to 14 days, you'll either get your stitches, your staples out, and that's where we really hit the ground running. And after that, it's just a matter of getting you strong. Again, there are no precautions in terms of what you can or can't do. It's just progressing range of motion. Normal range of motion, we want to get that knee completely flat. That's 0 degrees. We want 0 degrees, and we want it to bend to at least 120 degrees. If we can get to 125, even better. 130, amazing. You're flying through it. Afterwards, what you can expect, it should be pretty normal daily activity. Your knee's going to feel a little different. Obviously, you have some sort of implant in there, so you're not going to have that same joint feedback as a side that maybe doesn't have that. But in terms of function, strength, stepping up, stepping down, being able to pivot, golf, things like that, most folks have no issues with that. The big thing that I'll see sometimes a couple years out is that we start to lose range of motion a little bit. And folks that initially had really good range of motion, because they start using it more, focus more on strength or just more of using the leg, and they don't focus on preserving that range of motion, and you can backslide a little bit. So making sure that even though it's a real basic activity, keeping your knee moving long-term is going to be super, super important. The other side is that sometimes the knee capsule gets tight around it, or the thigh gets tight because it's being used more, and that can put pressure on the knee. So making sure you're stretching appropriately throughout the thigh and the hip muscles to make sure the hip isn't getting, or the knee, is not getting abnormal pressure. So we do have a guide that I kind of put together that kind of tells you, hey, there's what to expect day of surgery, what to bring. Here's what to expect in kind of your prehab, and then what to expect in your rehab. It's a little more in depth than what we talked about. The link should be somewhere in the video description below. And then obviously, if you want to talk a little more in depth, we do have those discovery visits. You can click on that, sign up, and that'll let us know you want to chat a little bit more. We can definitely do that. But I hope you guys have a great day. Hope you found this useful, and we'll catch you on the next one. Have a great day.